This is Seeds Podcast, bringing you tips, conversations, and information about applied behavior analysis.
Hello, everybody. Welcome to another episode of Let's Talk ABA. It's Seeds Podcast. Today, we are very, very honored to have a guest who is an expert in trauma-informed care. Her name is Fenella Ting. And before we let Fenella introduce herself, I'm just going to let everyone know that today's topic is we're going to talk about trauma-informed care. Now, a lot of you may wonder or may have not even heard of what trauma-informed care is, especially in the field of ABA, in the field of special needs, in the field of autism. So we really want to bring some awareness about this topic into the field so that we can start thinking about what is trauma-informed care and how can we incorporate trauma-informed care into our practices when we serve the community of special needs. So without further ado, I think I'm not an expert. I'll let the expert speak. So hi, Fenella. Thank you for being with us today.
Good morning, Alexa. Good morning, everyone. Thanks for having me today. And before we even, start the session, Alexa, thanks for giving me such a big head for considering me as an expert. But I do want to share that it was a past experience that allowed me to expose in the trauma-informed care approach. So I'm still learning. So I won't consider myself as an expert yet, but more like sharing my experience with you and also our audience here.
Yeah, thanks, Vanilla. Can you tell us, you mentioned that it was an experience, you had some experience, and can you share with us, tell us a little bit of your background and how you came to work within the scope of trauma-informed care?
Yeah, sure, definitely. So for now, I'm currently a registered counselor. So aside seeing clients provide the individual therapy services in my current role with my organizations, I'm also serve as a clinical manager supporting the day-to-day clinical work. And our center as well embrace the concept of trauma-informed care. And how I come across this was during my experience in the United States, prior of me relocating back to Malaysia, where I was provided the opportunity to work in a residential setting, where I work with the traumatic kids, high-risk children, adolescents, where they are being placed in this group home because they will struggle from the neglect and abuse from the family members, for example. So our organizations embrace this concept, the trauma-informed care approach, and all of the staff, so including me, are required to receive and undergo the training. Right. So that where my exposures to this learning coming from.
Right. So from that experience, and then when you come back to Malaysia and to continue your counseling practice, you continue to apply this framework in your practice as well.
Yes, because so happened my current director, she has this vision as well, to actually embracing this concept, to bring this concept in from, because this is still a more westernized concept. So to bring this concept in, and so happened we cross path and we discuss about it, and that's how we click and we decide to work on this together.
Wonderful. So Fenella, just you mentioned that just not the experience that you had in the US was in a residential facility for kids who has gone through some difficulties in their life, like neglect and all. Those are traumas, right? They have a history of trauma, right? So for our audience who may not be familiar, or even myself, I'm not sure, because I don't know what I don't know, right? I'm not sure about, or I may have some misconception as well. Can you help us define what is trauma, and from your experience? So and then the other question is trauma-informed care only for people who have experienced trauma, like for the kids who were in the residential facilities that you worked with?
Okay, sure. I think those are good questions, and those are two big questions. So remind me if I'm on the right track of answering that questions, because I'll separate these two first, so that our audience can also understand what is this about. So I will start by sharing the broad definition of trauma. So in general, the trauma can be defined as the experience that caused the intense physical and psychological reactions. So basically, it's an emotional response to this, to the traumatic event that can be only happen one time, or happen multiple times, and completely overwhelm the individual's ability to cope with that experience. So that's how we define trauma, and usually regarding what is the causes, and trauma usually relate to three common elements, which is it happens unexpectedly, and this person wasn't prepared, and also nothing that this person can do to stop it from happening.
So must have these three elements.
In general, this can be the common element, because and maybe I can give some example, Alexa. Like for example, the trauma that we can talk about, the big trauma. So there are big T or small T store trauma when we talk about it. So the big trauma, for example, the natural disaster. It happens unexpectedly, and then this we are not being told, so we are unprepared, and there's nothing that can stop us when this can stop from this event to be happen. So in general, that's how we see it.
I see. That's a great example. Vanilla. Thanks.
No problem. So moving on to our next questions, right? Or do you have anything else that you would like to further stay on in this, or we can move? Okay. All right. So you then the questions that you mentioned as well is that is TIC only applicable, right?
To people who have experienced trauma.
Okay. All right. Okay. So for trauma-informed care, it is an approach. So this is not an intervention. So it is a concept. So it is an approach whereby any organizations, they can practice, they can embrace this approach. So it is an approach where it requires a system change, where to make a paradigm shift in the way we approach our staff, the people that we work with. So instead of putting on the lens, hey, what's wrong with you? We change it to what happened to you? What have you gone through in life? So by shifting this lens, so it's not about treating the symptoms. It's more like providing the support in the services, so that it can be beneficial to any staff, anyone in the organizations. So that you and your colleague will feel supported by your organizations as well. It's not just the beneficiary, where it's not the clients that you support get benefited, but ourselves as the staff as well.
Okay. Thanks for the clarification. So what you were saying is trauma-informed care is not an intervention for trauma. It's a shift in the approach by whichever organization that is can I say whichever organization that's helping people that is in a helping profession can actually adopt this approach, so that the whole organization, including the client, including the people who are serving the clients, can also benefit from this approach.
Yes, I think Alexa, you put it very well. So if you would like an example, I can give another context here. For example, in a hospital setting, So in a hospital, right, you see clients. So you want to offer a safe environment for them so that you can help them to build some therapeutic relationship, trusting relationship with the service providers, among the service providers and clients. And at the same time, we know right now, right, with all these things that happen to the healthcare setting. So as somebody who work in the hospital, it can be a stressful situations and it might lead to burnout. But with embracing this trauma-informed care concept, by applying what it is in the organizations, it might able to help them to increase their overall satisfaction at work, to promote the wellness, to reduce the burnout, and to create a more resilient community within that setting. So that can be one of the examples.
I see. So it's almost like even with within the profession itself, we can also ask, because just now you mentioned a phrase, we want to shift the paradigm to not asking what's wrong with the person, but what happened to that person, right? So you mentioned, I think that that is a very powerful shift. So let's say if I am also supervising some therapists, if let's say they maybe that they did something like they are not themselves, I don't go and also ask them like, what's wrong with you today, but rather ask, oh, what happened to you, so that the overall, because in the helping profession, you mentioned like there could be some burnout and that that will also affect the patient or the client.
Yes, definitely. So like you say, not just service providers to the client, but like supervisor to supervisee as well. So basically it's the mindset, it's the change of mindset, and whether or not this person is struggle from trauma per se. Trauma seems like a big word, but then a shift in this mindset, if we're able to adopt that, it's actually bring more positive, it's more positive way in interacting, because when we adopt the lens of hey, what's wrong with this person, it's a bit more judgmental. So even we are not able to have a broader perspective, but when we shift within ourselves and in our mind, say, hey, what happened to this person, then actually we are seeing it in a more compassion lens, and in a more supportive way, that we would like to see what we can do as well to support our staff.
I can see how it helps. So even if like when we're talking to parents, sometimes when we're consulting with parents as well, and if let's say that parent seems to be struggling with some of the things that we're trying to teach, I can see how it can be beneficial for both parties as well, because I guess when we ask what happened to you, there are a lot more follow-up questions that we can work on, rather than what's wrong with you, and then we just stop at a very negative connotation and there's no like positive solutions that we can find together. Wow, I really like how you define TIC, trauma-informed care, for us, because back to, you know, like when I first heard about trauma-informed care, and like, the striking thing about this term is trauma, and it triggered my, you know, last time I used to be a psychology student, and I just, you know, remember like trauma, PTSD, and then how do you treat PTSD? So it was very intriguing when we're just starting to learn about TIC, and it's, you know, I just, you know, starting to find that, hey, you know, like you mentioned, it's actually not a treatment, but it's an approach that and I really like how you know, the whole organization can adopt. It's not actually a therapy skill to learn, right?
Yes. And actually, Alexa, when you mentioned that, I also recall when I first introduced with this concept in the state as well. I'm like, what is this? And I was also, it's a brand new idea for me. And in the beginning, I also like struggle to understand that concept itself. I was like, why are we learning this? Like all this lah, like not understanding. But as I do the work, as I undergo the training and seek supervision, then all these things slowly come into places, make more sense to my understanding of this concept.
Right. And I really like how after your explanation, I start to see how TIC can be applied not only in a counseling setting, like even like we mentioned, even in a hospital setting, in whichever human service profession that we can start to think about TIC in a whole organization kind of
perspective.
Okay. So is then TIC a preventative step to take to prevent re-traumatizing? I guess just now we addressed the issue that it's not a treatment, it's not only for people who has experienced trauma before, right? It's not, right? So any organization, does it sound like it's a preventative step to not inflict trauma? And if there's anyone who comes through our door already with trauma, is it then a preventative step to prevent re-traumatizing? Because as I was doing some readings, and when we're starting to read some articles about TIC and ABA, I keep seeing re-traumatizing, so we want to prevent re-traumatizing. So is it then a preventative measure to take?
Okay. Yes, and again, I think this is a big questions. So let me see how I can answer your questions. So in general, you are right that Alexa, that people who experience trauma, they are at risk. They're at risk of being re-traumatized again in the social services or in the healthcare setting. So the lack of understanding and also the lack of the knowledge about this impact, the impact of trauma from the service provider, then it can prevent to offer them the more effective care.
Okay.
So when the client, the patient is being re-traumatized, right? Which means that us as a provider, the system has failed them, and it has led them to experience a trauma again, and perhaps they feel unsupported, and even either blame themselves or blame the service that they receive. So it can be a damaging circle that prevent them from growing. So again, so if we're able to embrace this concept of and we're able to again shift the lens from a judgmental lens and adopt a more trauma-informed language, trauma-informed practice in supporting them. And ideally, it is hoping that we can help them to build resilience. So basically, to prevent re-traumatizing, in a way, I see this as to empower them and to able to help them to be more resilient. They come up to be stronger during the process of recovery. So that's actually how I see it as well.
Okay, so you mentioned empowerment. So when we are using the TIC approach, the goal is to prevent re-traumatizing. Of that's a given, right? It sounds like it's like just as you mentioned, like if you re-traumatize, you actually fail to support the client. And then you mentioned empower, so you not only want to stop there just to prevent re-traumatizing, you also want to build resilience and to empower them. And I assume just because the trauma triggers can't be prevented all the time, right? That's why you want to build resilience and empower them, right? Is that right?
So you're actually on the right track, Alexa. So in general, again, when we talk about this TIC framework, right? In a nutshell, let me share with our audience here as well. So basically, there's a fundamentals. There's a fundamentals of 4 R's that we talk about. So the first R is realize. Realize the impact of trauma to this person can be happens on physically, emotionally, psychologically, the impact of the trauma. And then the second R is recognize. Recognize the sign and symptoms of this potential impact of trauma to this person. You're able to recognize that and then respond. The third R is respond. So once you recognize that, then you are able to respond to it as well. And how you, from a service provider's lens, then you might want to integrate this knowledge into your policies or procedures. And from the client's perspective, right? When you educate your client, so your client also realize what happened, with my past that lead me to what happened here and now with me, what happened, and with the realization, and then I can recognize, oh, apparently I am feeling this or I'm feeling that is because of this impact of something happened in the past. And then respond is I learn how to handle my big emotion, my overwhelming emotion when I'm triggered. And the fourth R that actually you had mentioned earlier on, the fourth R is resist re-traumatizations, where we don't want to re-traumatize again. So I would say the empowerment that you mentioned just now is actually along the process. So it is during the process when we do all these things, we are able to empower our clients, to support them so that they are able to regulate themselves when they are being triggered again. Because this might not, an issue that it can be easily solved just with 1-2 sessions. So by building all this skill set, by encouraging them with more positive way of approaching, by making them feel safe, all these things is actually able to help to empower them in this recovery process that contribute to the re-traumatizations, to being re-traumatized.
Yeah. Thank you so much for the 4 R's. So realize, recognize, respond, and resist re-traumatization, right?
Yes.
For our audience to repeat. Realize, recognize, respond, and resist re-traumatization.
Yes.
And I really like how you gave us the perspective of, so this 4 R is not just from from the service provider, but the client will also learn these 4 R and recognize these 4 R themselves, right?
That's how I see it. That's how I find that's actually can be a helpful way in embracing this concept, because it's really very, it covers basically the framework,
the whole framework. I can see, I can start to see how it's actually quite relevant to when we work with children with autism and related disorder, right? So some of the children that we work with, they have verbal skills, they have quite complex verbal skills, so they may be able to, if we ask them and we probe a little bit further, what's your feeling now, even after they have a tantrum or whatever, I can see how if, let's say, the service provider or us, the therapist, could realize and recognize some of these emotional responses, I can see how we can work through with the big feelings, what we tell kids, big feelings. But there are some children who have limited verbal skills, so they can't describe their feelings very well. Some can, some they use, we teach them to use their tablet to communicate. They are able to identify, I'm sad, I'm angry, I'm, at a certain situation. just now you mentioned like, realizing the first realize that there are some responses, there are some emotional responses, right? So I guess are there some ways we can identify a certain behavior as a trauma response, if I can, if that's a valid question even. Because we see kids sometimes, maybe later I will give you some examples that are, we always say in a behavioral perspective, right? Because we use a background, we don't say behavior happen for no reason. It always happen for a reason, and it's our job, for especially for kids who can't tell us, it's our job to help them find out, to analyze this, right? It's called behavior analysis, right? To analyze their behaviors, to find the reason. But there are really some cases that are really bizarre, and we really, couldn't, and we're starting to recognize like some of these are meltdowns, they are emotional responses to perhaps something they're replaying in their mind that we can't get it out from them. So from your point of view, are there some of the like, how do we identify some trauma responses?
Yeah, sure, Alexa. And yeah, this is a big challenge, especially based on the examples that you provided just now. And again, let me try to share with our audience here again. So when we talk about the autism children, right, we talk about this autism spectrum disorder, ASD. From my understanding, it is neuro and developmental disorders that affect how they interact or communicate and learn, right? So and I also do some research before I have this conversation with you to ensure my understanding. So basically, although we mentioned that the researcher, they has yet able to identify what is the real cause, but a lot of studies did shows that it can be the gene and also the environment that factors that contribute to that. So that's my understanding, right, Alexa? Correct. Okay. So then back to your questions. So when the questions that you asked just now of these children, they might and they might not struggle with this. Struggle with some of the traumatic stress event in the past that lead to the way they behave.
Right.
So some of them might really, struggle with this neuro and developmental factor that detriment their ability to speak or to perform. So and as you say, so you're the you are experienced ABA as expert here as well. So I'm sure that there are skills that you guys apply to work with these children. And on the same note, so what I'm hearing as well is that how are we able to justify their inability to express themselves is due to the traumatic experience that lead to maybe shutting down. So that's the way for them to cope with the situation. Am I right? Am I on the right track?
Correct.
Okay. All right. So if that's the direction that we go to, so a concept that I would like to share with our audience here, and some of us might familiar with this, is that this is our body is the trauma response, that how we cope with this traumatic experience, and our body will respond to it. And a very common terms that we heard are fight, flight, or freeze response.
Fight, flight, freeze.
Freeze. Yes, that's the common terms that how our body react to the situation. So and I would like to also give us a context here where sometimes the same events that happen to two person, something, it can be traumatic to one person, but might not to another person. If this person feels supported and have a chance to talk about it and process it, so it will be just another daily things that happen to their life. So given that, we are saying that for some children who experience that and not able to get the support, so what might happen is that and how we can catch all these signals that they throw through examples such as maybe they have intense or ongoing emotional upset, or there's a sudden change in their behaviors, or they are not able to form healthy attachments with the adults or people around them, or they have some regression on the skills that they learned in the past, or some nightmares, or the body can show with some physical symptoms such as certain pains in the body, or even the IBS, the irritable bowel symptoms, can be a part of the signals that they show from the stress that they receive in the past.
Right. Thank you for that clarification. So nightmares, those are things that could be red flags that we should look into if some of the kids can't verbalize their emotions and whatever they're going through. If so, you mentioned consistency of, let's say they keep having a meltdown, an unexplainable meltdown, regression of their skills, IBS, nightmares. Thanks. That will be very valuable.
But that's just in general. These are some of the symptoms that might happen.
Right. And you also mentioned that just now you mentioned, I guess it reminded me back to the 4R again, because just now you mentioned some they can't tell, and how two kids, some they have the support, they may not go through the trauma because they have someone there to support them to work through. So I guess we could also, realize, so after we have this knowledge of this approach, we could realize and recognize and then help them cope, right? So that they don't go through the trauma, right? So versus another kid who don't have support or don't have people around him, have this knowledge to support him when he's going through some stress.
Yes.
He may be going towards the trauma, that direction, right?
Yes, you're right. You're right, Alexa. And also to share, when in the therapy work that we do, we work with children, and one of the things that I always emphasize to my team is that when you work with children, you need to include the parents. You need to include at least the parents in the picture, because the support system, I mean, on the note that they have the support system, the parents in this situation is their support system. So we want to include them in there, so that they can play a supportive role to the children, because they might not, given the consent, consent or this thing, and in the ideal situation, you educate the parents as well what's going on. You help the parents to understand, and then from there, with the awareness, then they might able to actually understand the behavior that portrayed by the children, and is able to respond in a more supportive and effective way.
Right. So we're back to, empowering parents to realize, recognize, and then respond.
Yes.
Then that leads to resisting re-traumatization.
Yes.
It's so amazing, because throughout our conversation, I can see how this 4R is, you mentioned now it's applicable to the parents as well, so that they can better support their kids.
Yes.
And then how we as therapists can also do that with our kids.
Mm-hmm.
Wow.
And including parents, yes. And I'm sure in your job you work a lot with parents as well, right?
Yes. And I guess if we could help the parents, bring awareness to the parents, then they can better support their children more effectively as well. Yeah. Wow. Okay. Thanks for that, Vanilla. It's really eye-opening. So back to trauma responses. You mentioned a few just now to give us some things to look out for. And then those are general things that we want to look out for. I just want to give you some examples. So like we encountered a kid when we first worked. This was many years ago. So of course, during our intake, we would ask a lot of questions to the parents regarding, their skill level, where they're at, and whether or not they've been to other kinds of services and how they respond to those services before coming to us. But then, so these are like general questions that we ask. But then there are very small granular thing that we notice after we could only notice after we start working with the kids. So there's this one kid where we will sit with each other, but then sometimes we just want to get up and take something, so our hand would, move like above his body level a little bit. And he, so actually our principal Asian picked this up, right? So we were at that time very focused on teaching him skills, that's what we do in ABA. But she noticed that whenever we do this, right, he would, it's very quick, like the reaction, he would fidget, and he would like almost automatically raise his hand to kind of protect himself or like block. So then we, this was before we learned about TIC. This example just stuck with me because it shows us like this something must have happened, right? This behavior don't come naturally to everyone, right? So at that time we were trying to think like, okay, something must have happened. We don't know what, we don't know why, we don't know when, we don't know how. I guess the question is stuck with me is that how do we go about, I guess we did acknowledge that, something must have happened for him to protect himself, right? But how do we go about responding to that if we could even go there, right? Do we initially stop raising our hand to do that? Build some trust with him first, or to let him know that, hey, we're not here to hit you. I just want to grab something. So you don't have to be so vigilant. So just now you mentioned like fight, flight, freeze, right? So I guess this is one of the behavior presentation of fight, right? Like or flight, right? Because he's protecting himself. So how do we start from the beginning again, I guess, to like, let him know, hey, we're not that, we're not here to do that to you anymore.
Yes. I think that's a good example. And then when you mention, right, Sian, your director picked that up, there's actually a goosebump that I have some goosebumps, because I think that's really good, for us to able to identify that. Because the you mentioned just now about another example of the kids is not able to express themselves verbally. So this can be the examples that that this child might not be able to express it, but the body is actually responding. So the bodies is actually telling the stories. And there's this book by Dr. Basil van der Kolk that I would highly recommend to all of us for a read, is to, if you're interested in the trauma work, the title of the book, The Body Keep the Score.
The body keeps the score.
Yeah, the title itself meant everything. So the body remember whatever happened in the body remembers. So it can be a reaction from our nervous system when you mentioned, right? The boy automatically raised his hand. So back and how's that relate to what we're doing, right? Again, so back to the purpose of today's sharing on this TIC. So one of the fundamental concept, the pillar of TIC, Trauma-Informed Care, that we talk about is to create a safe space, providing a safety place for ourselves as a service provider or for our clients as well, whether this is physically safe, safety, or feeling emotionally safe. So when these children they're able to feel that they are safe in the surrounding, then they might lower their guards, and then you can use different ways or attempts to build the trust with these children, with the children, and if the examples that I experienced in the past in the state where the therapy is not like, especially with the population, the high risk population, it's not like, okay, they come into my therapy room, sit next to me, then we just talk. So it's not like that, because why would they want to listen to me, right? A strangers, for no reason, and they've been through so much. So what can play out is through playing with them, engaging with them, draw with them. They don't want to talk, respect them. It doesn't need to talk first. I'm here, and then when you're ready, then we can talk. But now let's draw. Let's do some art and craft together. Let's listen to the music together. Let's run together. So all these things is some things that you would like to work in building the trust with the children, and at the same time to let them know that they are safe when they are with you. So I hope these examples is able to give you some ideas.
Yeah. And I think it's very so you gave like these examples is very in line with what we do as well. Before we start teaching, or like we also always want to build the trust first, right? So do things that they like, right? Not do things that we like.
We want, not we like, we want.
yeah. Not do things that like, I'm here, like for you is I'm here to talk to you about your issues. For us is we're here to teach you the skills that you need to catch up on, for the lack of a better word. But before I really like how you say, why would they want to do that with you, right?
Yes.
So the first step is really to build that relationship with them,
yes
trust,
to offer that space, to offer that space for them,
right? So that they feel safe,
yes,
so that emotionally and also the physical environment is safe for them. Build that relationship so that they're not guarded, right? So you mentioned that we don't want them to be guarded all the time. I see. Okay. Thanks for the clarification.
Given this concept of TIC, it helps you to have a different way in conceptualizing what's going on with the kids that you're doing. And I find that if you find that this is a helpful concept, perhaps that some things that you can try it out to see whether or not this will be more effective in supporting the children that you work with, because this can give you a more holistic perspective, right? Not just from the behavioral perspective, which is very important, but at the same time incorporate what's going on with the body, what's going on with their neurobio, psychosocial, how we can actually adopting this as well into supporting the children. And I will say it's not going to be an easy work.
I know.
It is not. It's actually it's going to take up more times, and it's going to be a process that it requires the team to work together, a lot of self education, at least, I mean, just sharing from my experience, a lot of educations that I read just to understand what's going on with, you know, this concept, what's that concept, like, so that I can I'm able to actually feel more comfortable as well, like you say, right, to actually know more about this framework and apply that.
Yeah. I think you mentioned a very important keyword there, more holistic. So like now knowing, for all the educators out there who is listening to this, TIC is not like we're changing what we're doing. It's not like we're totally, throwing away what we know, but having knowing this concept, knowing this approach could just kind of add on and help us think about a more holistic possibility when we're dealing with meltdowns and when we're dealing with big feelings from our children. And again, I when we start to do that again, going back to what you mentioned earlier, we are then starting to ask what happened to you, right? So
Yes. I think you're connecting the dot here, Alexa.
Yeah. I am. I think the 4R is great, a great start. If we don't know where to start, so realize, right? I guess this podcast is also we're now realizing, right?
Yes. And that's a fundamental, again, when we talk about the TIC. I think the basic is the realization part. Realize the importance of mental health, realize what are some of my options out there for services, that the awareness, I think, is important to begin with.
Thanks, Vanilla. So we're coming to almost the end of the podcast, Vanilla. But if there's just one takeaway, I mean, we unpacked a lot of things today. We talked about trauma, we defined trauma, we talked about the whole framework almost of TIC, and I'm sure there are a lot of information that we haven't covered, and it's not possible to cover in an hour. I mean, Vanilla, with your experience and all you just mentioned, you're also still learning, right? So it's a very big topic, but my biggest takeaway is the 4R and the book. I'm going to read the book. There's one takeaway for the audience about TIC that you could just summarize. What would it be?
Okay, so again, Alexa, thanks for having me today to share about this concept with our listeners here. It's really, an honor for me. And the takeaway message that I will like to share is something that I always reminded myself and also my colleagues that I work with, that to the importance of taking care of ourselves in the field. So the common analogy that we might encounter is the oxygen mask metaphor, that if you travel on a plane and if that's happen with this low cabin pressure, we'll get reminded, right, to put on the oxygen mask ourselves first. So please remember, self-care begin with you first. And please be kind and gentle with yourself when you are doing the work. And this is not an easy work. The process can be a challenge. And please always remember to practice self-care. Take good care of ourselves in order to offer a better care for the other people. So.
Thank you so much, Vanilla. That's really nicely put. And that will be the end of our episode today. Thank you so much again, Vanilla.
You're welcome. Thank you. Have a good day, everyone.
Bye. That was Vanilla Ting speaking to us about Trauma-Informed Care. We thank her once again for joining us on Seed Podcast.